Hi, guys. Good morning or good afternoon or good night, depending on where you are in the country. Please let me know if you can hear me okay. I have started. I just want to make sure. Let me look in the chat here. Okay, well, I'm not hearing anything, so hopefully you can hear me okay. So I want to start off with a few announcements because if you haven't been up to date on what's going on with me, first and foremost, I've started a podcast, which is available, going to be on Fridays. Great, you can hear me. Wonderful. So you're going to be able to hear me on Fridays with podcasts. I'll be doing solo episodes as well as bringing guests on. So please subscribe to the podcast on Apple TV, Spotify, whatever you use to listen to podcasts, because it really helps me out, and leave a rating or review. I think it's going to be really great to get experts on all sorts of things that are related to sex, not related to sex, but generally related to health and how we can improve our lives. Um, in terms of this, if you are enjoying Ask Me Anything, you can become a premium podcast member, where I will be taking questions from our Ask Me Anything section, and I will be answering them in specific podcast episodes that will be only available to premium members. So this is fun. I love doing this. I love being able to answer your questions. And now I'll be able to give it as a special exclusive to my members. Also, you'll get access to the content early, as well as the transcripts from all the episodes, and ad free. So that's really a wonderful opportunity to not be bothered by advertisements, because who wants to listen to ads anyways? And you can join the membership at renamalik.supercast.com. renamalik.supercast.com. Lastly, before we start answering questions, I also, if you don't know, have started a practice, my own private practice in Newport Beach, California, and I see both in person and out of state patients. People can come see me in person, or if you are located in the states of California, Florida, Illinois, New York, New Jersey, Maryland, Virginia, and Texas, I can see you as a virtual patient. If I can't see you as a virtual patient, I can see you for an educational visit, which means I can't diagnose and treat you because I can't be your doctor because I'm not licensed wherever you live, but I can at least talk to you about your condition and give you advice. You can do all those at renamalikmd.com/appointments. Also, we're running a special right now. So if you sign up for a new patient visit before January 26th, you can get up to $1,000 off if you decide to get Shockwave treatments. And I've talked about Shockwave a couple times on this channel. Shockwave is a regenerative treatment for erectile dysfunction and for other conditions, which we're sort of still investigating, but things like pelvic pain, prostatitis, pudendal nerve injury, incontinence, those sorts of things, we're still in the testing phases of that, but it may help. But in terms of erectile dysfunction, the data is okay. In terms of if you have the expendable income to invest in it, I still recommend that you try to get enrolled in a clinical trial, because that's the best way to get evaluated for the efficacy. And so we can have better long-term data. But at least as of now, we are seeing a benefit in the right patient to get Shockwave treatment. And if you continue with maintenance therapy, that can be maintained and hopefully help create more blood vessels in the tissue, rather than taking medication or doing other things that are not really fixing the problem itself. Okay. Any questions about that before we get started? All right, there are so many wonderful questions here. Let's see where we're going to start. Thank you, guys. Thank you for the happy holiday wishes. I see some of my patients here. Thank you guys for joining in. I miss you all if I haven't seen you in a while. Um, let's see. Is there a cure or remedy for retrograde ejaculation? This is a great question. So, retrograde ejaculation occurs when you ejaculate, but instead of the ejaculate coming forward and out through the urethra, it goes backwards into the bladder. Now, this is something that occurs often because of medications, which can cause retrograde ejaculation, like alpha blockers. So you may have heard of Flomax, tamsulosin, prazosin, alfuzosin, doxazosin. Those sorts of medications can cause retrograde ejaculation. Now, the way to fix that is to stop that medication. If you've had a transurethral resection of the prostate or prostate surgery, that can also affect forward ejaculation. And that is unfortunately not reversible, because once you've had surgery, it affects essentially the ability of the bladder neck to close and allow forcing that ejaculate volume to move forward. Now, the other cause of retrograde ejaculation that is very, very common is diabetes. So diabetes can cause retrograde ejaculation, which is what I see a lot. And again, retrograde ejaculation, just to be clear, is not dangerous. It's not going to hurt you unless you are trying to get pregnant or trying to conceive. So in that case, it does need to be addressed. So if you are bothered by it, which is totally reasonable because it can be a very shocking and alarming thing to either have reduced semen volume or have retrograde ejaculation, there are some sort of off-label treatments. One of the ones that we often try is to take a higher dose of Sudafed about a couple hours before, actually a couple, like 6 hours to 12 hours before you want to have intercourse, to see if that improves forward grade ejaculation. Now, if these things don't work, you can then go on to procedures to then obtain the semen from the urine and actually use it for fertilization if you are having this issue. So there are some off-label treatments. They're not great. They work in some percentage of people, not all. However, oftentimes, unfortunately, it's not necessarily reversible. But like I said, if it's due to a medication, stopping that medication will help. Okay, let's see. Is there any way to prevent prostate enlargement? So I'm working on that video right now. I'm actually going to be putting it up next Monday. So make sure you come back to learn more about it. But I will just tell you one major important thing, and that is exercise. So there's an abundance of data on exercise in preventing prostate enlargement, as well as diet. So most of the data is on Mediterranean diet, avoiding high fats, as well as avoiding and eating more vegetables. So those are things that we know help, and I will go into more granular detail in that video. Okay, let's see. So there's a great question here about recurrent urinary tract infections for women and what you should do about it. So what are the causes of recurrent urinary tract infection? Very often, they happen more often in women because women have a shorter urethra, which is closer to the vagina, where essentially these infections start from and then kind of get into the urethra. And sometimes, and so that's very more common for women, but that doesn't mean that it's okay to have recurrent urinary tract infections, particularly if men are getting recurrent urinary tract infections. It's a big red flag. You need to get investigated, but so do women. And so women, the causes for both genders that cause recurrent UTIs is not emptying your bladder. So in this case, the person who asked the question said the urine comes out as a trickle. Well, that may be a sign that you're not emptying your bladder well, in which case that urine sits in the bladder and is basically food for bacteria to multiply, because our urine is not sterile. There is bacteria in the urine. And so when the urine becomes sit stagnant or sits there for a long period of time, the bacteria grow, multiply, and create urinary tract infections. And so it's really important to make sure you're emptying your bladder well. Another thing is to make sure you're drinking lots and lots of fluid, because if you're not drinking enough fluid, your urine gets concentrated, more likely to get infected or cause symptoms of infection. Even concentrated urine without bacteria in it or without technically a clinical UTI can create bothersome urinary symptoms. Now, how do you know if you have a recurrent urinary tract infection or you're getting a urinary tract infection at all? Well, most commonly, people will feel pain with urination, like a burning pain. You may also feel all of a sudden you're going to the bathroom more often. And when you get there, you're not emptying very much, or you're having a lot of urge, like gotta go, can't make it. Now, these can be really detrimental, and they can create a really impact quality of life. And so it's really important then to get evaluated and talk to your doctors. And so that can mean making sure that there are no kidney stones or other stones or abnormalities in the anatomy of the urinary tract that's causing these infections. Or it can be particularly in women when they're postmenopausal, when they lose estrogen, because that's what happens after menopause, estrogen starts declining, it actually affects the microbiome of the vagina and it makes the pH higher. Normally, the pH is acidic, and this helps keep good, healthy bacteria like lactobacillus around that helps prevent UTIs. But once the estrogen goes away, that protective mechanism goes away, and you are more likely to get UTIs. And vaginal estrogen is very, very, very safe. There's never been a reported breast cancer, blood clot, uterine cancer, any problem like that with vaginal estrogen. And the reason is because it is located in the vagina. When you put estrogen in the vagina, it mostly affects the local tissues. Now, a very small amount gets into the system, but not even close to the amount of estrogen that women get premenopausally. So vaginal estrogen is very, very effective. So you should absolutely get evaluated by a urologist if you're getting recurrent urinary tract infections. One, to make sure function and anatomy are normal, and two, to assess if you're having a problem with your vaginal microbiome and may be a candidate for vaginal estrogen. All right, all right. What else do we got here? Okay, so okay, I see a question here. The Whenever I have the urge to urinate, I end up just pissing myself. So this is called urgency urinary incontinence. And it's very common. In fact, overactive bladder, which is gotta go, can't make it, going often during the day, having these types of accidents because you don't make it in time, or waking up at night to urinate, this constellation of symptoms occurs in up to 16% of the population, which means if you have 5 to 6 people in a room, one or two of you may be experiencing overactive bladder. So it's very, very common. Now, the causes of this are multiple. It can be due to age, it can be due to genetics, it can be due to bladder irritants. So, if you're eating or drinking a lot of bladder irritants, I've made a video about bladder irritants, which can include coffee, caffeine, alcohol, spicy foods, artificial sweeteners, um, sometimes even carbonated beverages, tomato-based products. These things can irritate the bladder. Now, I'm not telling you to stop all of them, because certainly if you stop all of them, then it can be very difficult to sustain. But I say stop one or decrease one. I mean, I'm not going to give up my daily coffee, but I certainly drink decaf. More often, because it helps me not have to rush to the bathroom. And so you kind of decide what is creating more bother in your diet, and you can decide to cut back or reduce that if you like. So remove one at a time and see how it goes. The other thing that can cause urgency incontinence, particularly in men, is an enlarged prostate. So I've made an entire video about enlarged prostate, but essentially what happens is the prostate is a walnut-shaped organ that sits underneath the bladder. This enlarges with time, and then when it enlarges, it could actually block the flow of urine. So normally you would think that this would make it difficult to pee, and very often that is the symptom that people present with. They're having a weak stream, their stream starts and stops, they have to wait a long time for the stream to go, but that's not always the case. Sometimes it's that when you are going to the bathroom, you essentially, so when you are, because of that obstruction, your bladder becomes overactive. It's reacting to the obstruction. And so you have these overactive bladder symptoms like urgency or leaking before you get there. So in those cases, treating the obstruction or the enlarged prostate can be very helpful. Now, I talked about bladder irritants. Another easy thing that you can do is make sure you're not constipated. So constipation can worsen those symptoms. The other thing is watch what you're drinking. If you're drinking a gallon of water a day, you're going to go to the bathroom very often, and sometimes your bladder may have a spasm and you may have an accident. And so if you're drinking a lot and you're feeling great, that's wonderful. But if you're going to drink a lot and you're not making it, then it may behoove you to cut back a little bit. And so what I tell people is drink whatever you want, breakfast, lunch, dinner, and then just sip on a bottle of water throughout the day. But taking, big gulps of water will make your overactive bladder worse. Then lastly, I said constipation. If you're smoking, that's going to make it worse too. So smoking not only causes bladder cancer, lung cancer, a whole host of horrible conditions, it also can make your overactive bladder worse because smoke is a bladder, not smoke itself, but the things that process through your body are bladder irritants and will make you go more. And also it may make you cough, which in some people can make you have leakage accidents called stress incontinence. And then lastly, weight loss can be very helpful in those cases. If you are struggling with all these things, it's not your prostate, we have a host of treatment options available for overactive bladder. I won't go over them in detail here. Just check out my video on overactive bladder and the 11 treatment options we have, and that will be helpful for you. Okay. Okay, this is a great question. This person said, I have sudden episodes of erectile dysfunction, and it doesn't happen every time. And this person has been on an SSRI. So erectile dysfunction or sudden episodes of having difficulty in performance, occasionally here and there is normal, right? If you can't perform 100% every single time, just realize that sometimes it's normal because sex requires a lot of coordination. Your brain needs to be in the right place. That's very, very powerful. So having your brain in the mood, in the right place, not stressed, not anxious, is really important. Then you have to have good blood flow. Your hormones have to be working correctly. Your nerves have to be working correctly, and you have to be on medications or not on medications that can affect your sex drive. So all of those things taken together are a part of a good sexual function, and in this case, good erections. So if you are on an SSRI, SSRIs do cause, and sorry, an SSRI is an antidepressant that is often used for depression. And so if you're on one of those medications, it does cause sexual dysfunction. And in some cases, erectile dysfunction. More often, it creates issues like delayed ejaculation and decreased libido, but it can affect erections. And so if you are experiencing sexual dysfunction, please talk to the doctor who prescribed you the SSRI. There are alternative medications, or you may even be able to reduce the dose and see less side effects because it is dose dependent. So those things are really, really important. All right. Okay, this is a good question. If you are taking TRT, which is testosterone replacement therapy, are supplements that interfere with DHT, like saw palmetto, pygium, or other prostate meds or supplements, something we should avoid. I don't want to make my TRT less effective. So, in terms of supplements, I will always leave this caveat that supplements do create are not FDA regulated. Sometimes what's on the bottle is not what's in the supplement. Sometimes the dosing variability is very, very off. And because supplements come from plants and plants themselves have variability, they may not be effective sometimes and they may be effective other times. So it's important to make sure you're getting your supplements from appropriate vendors that do appropriate lab testing, which you can check on their website. Ideally, they've gone through some certification in the US. They have the USP, which is the US Pharmacopoeia organization that sort of governs them a little bit. So they should have some symbol on their bottle that says they've gone through that. And that generally they are, a reputable source. I would say the cheaper they are, they're probably using fillers and other things, and they're not exactly the appropriate supplement, but I would do your investigation on your own. I don't spend a lot of time looking at supplements, at least in terms of the variety of different ones, because that's not what I prescribe very often. However, I will tell you that they work, these ones that you've mentioned work by inhibiting the conversion of testosterone to DHT, which is the major androgen that's in the prostate. And this can help make more available testosterone in some cases. However, saw palmetto and pygium don't really show that. They don't really affect testosterone levels. So no, you shouldn't be concerned about this affecting your testosterone replacement therapy. And so it shouldn't be an issue, really. It shouldn't make it less effective. Okay. So yes, Balanitis. What is it? David Lawson asked, what is the best treatment for Balanitis? So Balanitis is an infection of the foreskin. And so depending on the degree of infection, antibiotics is usually very helpful, but the goal is to prevent balanitis, right? Once you get it, you have to treat it with antibiotics or topical creams. But once you have gotten it and you've gotten it clear, it's about preventing it. So you want to essentially make sure that you're always, this is for people who have an uncircumcised penis. They can get an infection of the foreskin. Usually, if you're circumcised, this doesn't happen. But basically, you want to pull back the foreskin, make sure you're cleaning in the area, you're drying the area, and then putting it back, and so that you don't get buildup of these normal oils and dead skin cells that can occur, and then eventually create infection. And so that's really the most important thing that can occur that you can help yourself to prevent balanitis. Okay, we're going to do just one more question. Okay, this is a good one. What should I look for while looking for a good urologist? So I would say that in terms of looking for a good urologist, you want to find someone who, one, you feel like is giving you the answers, is really spending time to understand what your goals are. So in a lot of what, at least what I do, is quality of life, right? So my goal may be something very different than what your goal is. So it's really important to find someone who looks at you and says, I want to make you happy. So, what is your end goal? And then also talking to you about how realistic that goal is. Sometimes it may not be realistic, but ultimately saying, okay, we're going to work towards it. We're a team and we're going to work together. Also, sometimes you won't get along with someone, right? We're all human beings and you may just not like somebody. And if that happens, it's very reasonable to go get a second opinion. And no good urologist will say, don't go get a second opinion. Everyone who is a good urologist or good doctor will always say, we want you to get a second opinion. We want you to feel secure with your doctor and feel happy. The other issue I often find is that, and this is not because anyone's a bad urologist, it's because we are constrained in the United States by insurance. And those are the ones who are mostly paying doctors to see patients. And what happens is they've now reduced reimbursements, and with the cost of doing practice, of taking care of patients, you have to see so many patients in a day to actually make ends meet. And so it is a big pressure for doctors, and not often by themselves. Usually they work for hospitals, they are employed, and they have to only spend so much amount of time with you. And it's very difficult to get all the information across. That is exactly why I started my practice, because I wanted to be able to spend time with patients. So in my practice, I see everyone on their first visit for an entire hour because I really want to make sure, one, that we are on the same page about what your goals are and that I can answer all the questions that you have, because I think it's so, so important. And we just don't get that anymore. And I will say I've really enjoyed it. I love getting to know my patients. And it's made me a better doctor because I can spend more time listening to them than me just talking. Which I enjoy talking, obviously. So, as a reminder, guys, if you are enjoying these Ask Me Anything episodes, please check out the membership, the premium membership, where I'll be doing these monthly, okay, with your questions. If you're a premium member, I will be answering your questions. renamalik.supercast.com. renamalik.supercast.com. Become a premium member, and that way we'll be able to see each other or talk to each other, and I'll be directly answering your questions, and you won't be among thousands of people here asking me questions. Also, let's see here. I would love to show you some of my products if you'd like to buy them. We have a mug as well as a water bottle. So you can check those out if you'd like. They're just fun sort of things. They remind you to take care of yourself because you're worth it. And you really, really are. And please feel that your body, your health, your sex life, everything is very important. And as much as we love to take care of other people, you can't fill from an empty cup. So take care of yourself first so you can take care of everyone else later. Okay. And as a reminder, we are running that Shockwave promotion. If you make a new patient appointment before January 26th, you can get up to $1,000 off your Shockwave treatments if you're interested in getting Shockwave therapy. I look forward to seeing you there. And again, as always, remember to take care of yourself because you're worth it.